Hi, this is Todd Mobbs. In my previous video, A Senior Healthcare Hell, I gave you a summary of events of my father Lee Mobbs' healthcare experience. In this video, I like to focus on Kindred Hospital. He was a patient at Kindred Hospital, Los Angeles from August 4th through October 19th, 06. At Kindred, we quickly noticed that he was not properly cleaned, groomed, and the facility was very dirty and appeared to be very understaffed. A few days later, the facility notified me that my father was dying due to complications of his initial stroke. The next time we visited him, we discovered a large pressure ulcer on his ear that they appeared to be hiding from us. Upon asking the nurse said that he arrived with that and many more, which we knew better of. After complaining about his level of care, the nurses became hostile and retaliative, taking far worse care of him, and they claimed he had numerous terminal illnesses, the first one which was stem damage, that he was going to be paralyzed, and he had stem damage due to his initial stroke, which we knew better of because the facility that he was at during that stroke did significant tests, and we knew that he was not in that state. The next one was that he had HIV. We told them to produce a document with a doctor's name on it saying they did. They did not. Then they went on to say he had cancer. We requested a document again. They did not give us this. He continued to develop more and larger pressure ulcers. At Kindred, it was very dirty and appeared to be very understaffed. The place had a foul odor, musty smell. The floors were sticky. We would come in and find him laying in his own waste, which he appeared to be for several hours, urine catheter overflowing on the floor, tubes leaking, feeding machine not working, wallpaper peeling, exposing mold, trash can overflowing with waste. I made complaints to the Department of Public Health in Los Angeles. My claims were not fully investigated. They investigated the pressure ulcers a year later. They did not inform me though. An advocate found out 9 months after they investigated that they investigated the bed sores. They would not fully investigate. They will not take my written complaint or photos. I've spoken to Supervisor Eric Stone a dozen times. My complaint isn't even on the Department of Public Health's web page, complaint list page. In my opinion, the Department of Public Health in Los Angeles is a joke. Their reluctance to investigate creates an opportunity for abuse and neglect to occur. He was also a patient at Kindred San Gabriel for a short time. That facility as well was dirty and appeared to be understaffed. We had to request a few times that he be groomed and cleaned. He did not develop any pressure ulcers there. He was hospitalized for about 3 weeks prior to Kindred Los Angeles. He did not develop any pressure ulcers prior to Kindred Los Angeles. After Kindred Los Angeles, most of his stores were in stages of healing. Some healed completely. Later on, possibly due to medical conditions he developed during his hospitalization, poor care, failing health during his last days, they were slight setbacks, and he even developed some small new ones, but nowhere near as bad and as quickly as he developed them at Kindred Los Angeles. Upon noticing the bed sores, we requested that he be transferred to another hospital. Kindred, as well as the insurance Scan Health Plan, HMO, would not help us. They ignored us. Kindred was very busy attempting to obtain a do not resuscitate order from us. We believe this is why they were claiming that he had a number of terminal illnesses which they did not have any proof of. I am to understand that this would have helped cover up and reduce their liability if they obtained this. There were incidents of physical abuse, one of which I witnessed. The facility would just excuse. They have a quality control person, which from what I experienced, sole purpose is to excuse and to cover up this abuse and neglect. I've been told that I could get in serious trouble for making allegations against the hospital and taking pictures of my father's abuse and neglect. They were constantly trying to get us to sign a liability release. They had a meeting, what they called a family care conference, which was more like a bioethics meeting, which they made excuses and lied to us. Days prior to his move from Kindred, we would come in and find the food machine off almost every single time. We'd complain to the nurses and they pretty much would ignore us. Even when we asked for the supervisor, they said there wasn't any supervisor there. When he left Kindred Hospital, he was severely underweight and appeared to be in very poor health, near death looking. He was transferred to a nursing home, Hancock Park Rehabilitation in Hancock Park, California. He should not have been transferred from an acute hospital to a nursing home in his condition. He left Kindred in far worse condition than he arrived. I've seen other patients at Kindred with bed sores and being neglected. Eric Stone of the Department of Public Health says I cannot make a complaint on them because I'm not a family member of those individuals. Kindred has a history of such abuse and neglect, with lots of lawsuits and litigation. These events at Kindred Hospital, Los Angeles, are the most horrific thing I've ever witnessed. It is absolutely unbelievable that a place that is supposed to care for somebody would do something like this. Thank you for watching.